Thank you for tuning into NorthPoint Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today we're joined by Dr. Kevin Gilliam. Dr. Kevin Gilliam received his Bachelor of Science from Tennessee State University in 2002, his medical doctorate from the University of Cincinnati in 2006, and completed a residency in family medicine at Emory University in 2009. He is a diplomat of the American Academy of Family Physicians and the Minnesota Academy of Family Physicians, as well as the American Board of Obesity Medicine. He is the medical director here at NorthPoint Health and Wellness Center, where he also sees patients as a primary care physician. And he has also been recognized as a medical rising star and a top doctor in the Minneapolis St. Paul magazine. He has been involved in the development of the annual Fit for Fun event and is co-captain of NorthPoint's cycling and triathlon teams. So welcome, Dr. Gilliam. Thank you for joining us today.
Thanks for having me.
Absolutely. Today we are talking about health literacy. So we'll just jump right in. Tell us right away, what is health literacy and why is it important?
Well, I think looking at the words, health, it's related to your your wellness, your health, kind of straightforward, and literacy, the kind of the root of that being literate, being able to read and write or communicate. But I think when we combine those two things, health literacy, it's our ability to kind of obtain, so get things, process those, understand kind of a basic health information, and then also those services needed to make appropriate or the necessary health decisions. So it's being able to get, understand, and then use that information to make the right decision for ourselves.
Can you give us an example, a common example?
So, I guess a common example, given that we find ourselves still in the midst of a pandemic, and at the beginning of a flu season, would be immunization. So, for instance, under getting information about a COVID-19 vaccine from a source that you trust. So if you were to come to NorthPoint and ask one of the clinicians here about the vaccine, and then them explaining that or giving you some written material to read, being able to look at the words on the paper or listen to the words being spoken, and then actually being able to read them or understand them, and then processing that information, applying it to your life and your situation, and then making an appropriate decision for your health and wellness and for your livelihood. So people may make the decision that they do want to be vaccinated, and if you do, please, and you haven't, give us a call. We'd be more than happy to vaccinate you, no matter what it may be for. And then you may make the decision to not, but being certain that you have an appropriate understanding of everything or every factor that goes into being vaccinated and the upside and the downside of any decision that you might make. So I think that's a fairly good and fairly, prescient example of kind of what we're talking about. So it matters for us right now. So.
Absolutely. Thank you. Tell us, what are the principles of health literacy? What goes into it?
Essentially the principles are processing and understanding. And I've been doing some listening. So I listen to podcasts about kind of reading comprehension
Mhm.
lately. And, there's a fairly high percentage of people who don't kind of grasp the concepts of reading as a child easily. Um,
Mhm.
and there's a much smaller percentage of children or people that just get it right away. So written language is not always as easy to process and to understand for every person. Um, Although many people can read well and do, not every person can and does. And it's actually more people have trouble reading than the other. Um, so I think that with literacy and literate, meaning to kind of be able to read and write, reading is one of those central principles of health literacy. So to be able to take in the information, um, and that's just if it's written language. But if it's spoken language, that you're having a conversation with a health professional, being able to then understand the words and process those words. So certain levels of kind of education would be kind of helpful in processing some of those. And you don't necessarily need high levels of education, but the ability to critically think about things and how they might apply. So the processing of those things, and then kind of understanding how, so drawing lines between the connections between what's being presented, the information, then kind of understanding what the information is and what it means, and then also processing it to see how that then applies to your situation in particular.
Mhm.
Um, because if, for instance, kind of leaning back on our vaccination example, if I understand what a vaccination is, I understand why people may want them, but I don't get why as a person would need it, um, because I don't feel bad right now. I feel pretty good.
Mhm. Right.
So why do I need to get a shot that might have a side effect? Might have me feeling bad tomorrow when I feel great today.
Mhm.
Um, and so what's the big deal? So I think having the understanding that from the drawing the line of connection between understanding what a thing is and then how it also applies to my situation and how my situation might change from day to day or from moment to moment, and being able to kind of future cast a bit, because that is essentially kind of what we do as health professionals, are helping people to look beyond today's situation, um, and kind of forecasting into the future how we might be able to improve tomorrow and the days
Mhm.
to follow, um, and using language um, that is understandable and that can be applied in a real practical way to a person's life.
Thank you. And I think you touched on this, but tell us what could cause low health literacy. Spoke on it a little bit.
Yeah, I think generally, if there were some issues with kind of literacy broadly, and remembering that literacy is kind of reading and writing language, so if there is issue with kind of processing written language, or even kind of issue with processing um, spoken language. But then I think the other side of the coin is not always the the fault, or anyone's fault really, but if the information being provided is not being provided in a digestible way,
Mhm.
um, because none of us in our natural language speaks the language of medicine. It is something that I have gone to school for many years to learn and be able to understand and perfect.
Mhm.
But there are people with many more degrees than I do that have many more degrees than I have, that don't understand medical language, but
Mhm.
understand some other language. So being able to communicate complex medical topics in a simple way to any person.
Right.
And that is not a factor of kind of education attainment, but it is really just the reality of living, that it is on us as health professionals to communicate complex topics in simple ways that can be understood and digested. When I was in medical school in Cincinnati, we would round, so we would do hospital rounds in the children's
Mhm.
hospital. And as a third year medical student, what they would have us do was actually present the case. So whatever reason that child was admitted, to the child. So we would stand in the room with
Mhm.
a gaggle of doctors, so a bunch of white coats behind us,
Mhm.
uh, and look and speak to the child. And so it's a 3-year-old or a 4-year-old, and you have to use
Right.
language that child would understand as to why they were admitted to the hospital, what decisions we were making to kind of help them to get better, to feel better. And then the attending, so the lead doctor, would ask that child if they understood. And if they understood, then you passed. So it was, I think doing, having practices like that, and that concept
Mhm. Right.
is good for us as health professionals, to know that we want the the smallest of us, um, to have understanding, um, of whatever may be going on, because it is, people spend 20, 30, 40 minutes with us in an office space, and then they spend the rest of that time with themselves. So we want them to have a full understanding of anything that might be occurring or happening to, or for, and or with inside themselves.
Mhm. And again, you touched on this a little bit, but how would you say we can make health literacy more accessible to everyone?
Um, well, I think, health literacy also is just talking about it is really about advocacy for oneself, I think.
Mhm.
Um, and so encouraging people to to ask questions. And what I often suggest is, when you think of a question and you're at home, write it down, and
Mhm.
I'll write down all of the questions you have. And if writing is not a strength, talk into your phone, and it'll make a little note list for you,
Mhm.
and kind
Right.
of dictate into your phone. So then when you come, because oftentimes, you get flustered, or you don't remember. Um,
Yeah.
and it was weeks ago when I had this question, and now I feel better,
Mhm.
but I still want to know the answer. So
Right.
come in with your list, and either just slide it across the table, or read them down one by one.
Mhm.
And so that way you leave, um, feeling like you've gotten all your questions answered, if they were able to answer them. And if not, then they're working on ways to kind of get to an answer with you. And then if we on the other part of that is, if you're in conversation with a health professional and something comes up that you don't understand,
Mhm.
there's a word that's used you don't understand, um, ask. Say, I don't understand what you're saying, because it's not on you as a individual, as the guest, the client, the patient. It is not on you, um, to, um, just know everything,
Mhm. Right.
that will potentially be diagnosed or potentially be done. That's why you visit with us as trusted, um, people, to kind of inform and to kind of help guide through a process. Um, and so it's on us to explain it in such a way that is understandable, that you would get and be able to grasp, and whether that be through spoken language or written language, we need to be able to provide you with those resources, so that when you leave the space that we're in, you have understanding, and if not, you're on the path to understanding, with a clear process in place.
And this goes into my next question. So, how would health literacy or someone's level of health literacy affect their overall health?
Yeah, I think, if there's just a lack of understanding of what's going on,
Mhm.
there's then that potential of not being able to follow through well with whatever instructions or the plan that might have been put in place. Um, there's then there's also a potential that the there's a of not kind of seeing the value in the plan or the process that might have been discussed. You say, well, I know the clinician may have said that this is important, this needs to get done right away, but like I said, I feel great today, so
Mhm.
I don't understand, you know, why you think, I think hypertension is a good example of this. Um,
Mhm.
we refer to it often as a silent killer, because
Mhm.
oftentimes your blood pressure can be very, very high and you feel fine. It's something that we
Mhm.
actually have to measure to know.
Right.
And we know that when your blood pressure is super high for a long period of time, that it increases your risk for stroke and heart attack and many other things. Um, and so if I feel great, I know you told me that my blood pressure is high. I know you mentioned
Mhm.
to me that, my kidneys weren't doing so great, but I feel awesome today. And I know you said I should start this medicine to help lower my blood pressure, and I should meet with the dietitian. Um, but again, I feel great, so I don't really understand why you think I should. And so then that may translate into not taking my medicine every day, or not starting it as it was planned, or perhaps
Mhm.
missing an appointment or two here and there, or not using the blood pressure cuff that was provided to check my blood pressure at home. Um, you know, not worrying so much about my salt intake, um, not really engaging in a different kind of activity level or increasing my exercise. So not being as motivated, about some of the things that, if done well and with intention, would really help improve that blood pressure. Um, if I don't have an understanding of kind of what exactly you're talking about and why that's important for me in this moment. Um, so I think that's how, um, kind of a lower level of understanding or lack of health literacy can really impact a person's overall health.
Mhm. So, as we're talking about um, health literacy and the impacts of low health literacy, how would you recommend someone would go about improving their health literacy?
Yeah, I think, um, well, as I kind of alluded to it before, really, um, understanding that it is the our job as health professionals to make sure you understand things.
Hmm.
So with that, not being bashful in any way, or
Hmm.
don't have any shame connected with not understanding,
Hmm.
um, because we none of us start from a place of understanding,
Hmm.
and it takes time to kind of get to learn new things. So if there's a word that is used that you don't understand, if there's a phrase that's used that you don't understand, if there's a concept that's talked about that you don't understand, ask about it. Particularly, we see quite a number of people whose first language is not English.
Hmm.
Um, and so, I'm I grew I'm from the East Coast, have a lot of Southern connection and Southern roots.
Mhm.
So there are some phrases that I might use from my Southern heritage, Southern United States, that a person who grew up in, on the West Coast of Mexico or in Ethiopia or
Mhm.
northern Minnesota or in the upper peninsula of Michigan would
Mhm.
not understand. Um, as a quick example, um, when people say I'm going to the show, the first thing
Mhm.
that pops in my head is that they go into like, a live show, like a Broadway, kind
Sure.
of a theater show, because where I grew up, it was the movies. So
Mhm.
there is some nuance in understanding, um, even the kind of things we might consider common. And so if someone says, does it make sense in the context, at least in your thinking, does it make sense
Mhm.
in the context of what you're talking about? Ask about it. He's like, what do you mean? Like, I don't understand. So then that requires them then to get you to try to get you to a place where you have a better understanding of the concept, of whatever it is they're trying to get across. Because if you leave without kind of understanding and really having a good grasp on what's going on, um, there's a chance that you then will need to come back over and over again, or the thing that you're trying to address is not, um, won't improve in the way that is expected to, because you're not able to really apply some of the concepts, um, that are intended for you.
Right. And then finally, let's talk about what NorthPoint is doing. How are our providers working towards improving our overall health literacy as a community?
Yeah, I mean, I think, as like I mentioned, we see quite a number of people whose first language is not English.
Mhm.
So being certain, firstly, that we are providing care in a language that people understand, and kind of spoken language. So having live interpreters, so in person, real
Mhm.
humans, and then also if needed, a video or phone interpreter if we aren't able to get an in-person interpretation. But then also providing documents that are written in in their native language,
Mhm.
and ensuring that they're actually able to understand that language. Um, and then using language on our end, spoken language that is understandable, that is, and using other supports in the clinic or in our organization to help people to access different resources if, um, they need other supports to help in, getting to a place of deeper understanding, whether that be through the use of our community health workers, to kind of help guide them through the process of kind of working through their condition, um, or the use of our clinical pharmacists to kind of help with the understanding of kind of medications, the use of our registered dietitians to kind of really walk through the details of food planning and different ingredients that might occur, that might impact, um, from a cultural perspective, the ways in which our conditions and things kind of impact our bodies. Um, and so using all the tools available to us to ensure that, um, kind of leaning back on the definition of health literacy, that people are able to really kind of process, understand, and then apply to their lived experience, the things, that we, um, are suggesting to help them to improve their well-being. So, and we do that at every connection point, through using what we refer to as common language on the
Mhm.
website, using that same common language in our written communications, um, and in all of our kind of marketing material, having imagery of people that look like the people that we serve, um, trying to remove any barrier to accessing care that we can, and removing any barrier to understanding care that we can is what we're doing.
Absolutely. Thank you. And that is everything that I wanted to ask. So thank you, Dr. Gilliam, for talking to us about health literacy today. It's a very important topic. So we appreciate the time and your answers.
Thank you. Thanks for having me.
Absolutely. Thank you. Thank you for listening to NorthPoint Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know that times get hard, and we're here to help at NorthPoint. When you're feeling low.
And then speaking in the context of the public health and the general public's overall health,
Yeah.
Why is health literacy important that we would all understand?
Yeah. I mean, I think that's actually a pretty good question. I think it comes with collective understanding. Yeah, I think there are, community standards. We use community standards to help in determining, what things we might employ in healthcare and other kind of industries and things. But there are also community standards with, just how we think and feel about stuff. When I was a kid, it was cool for a little while to wear fanny packs, and then it was no longer cool. And now they're back.
Yeah.
And but there's a collective understanding that these are some of the practices that we will do. Back in the maybe several decades ago, it was fine to smoke cigarettes indoors. And then we learned, we got a different understanding. And now the community, we collectively have decided that that is no longer acceptable to kind of smoke cigarettes indoors in public spaces. And so there are other kind of examples that seatbelt wearing. We have collectively decided that after learning about the necessity to be safe and protect ourselves in motor vehicles, that we should wear seatbelts. But that was not a common practice before. So, as we, particularly, and now we're getting more of an understanding of kind of mental health concerns and the importance of addressing our mental health in addition to our physical health, it's becoming more and more acceptable in the community to talk about depression, to talk about anxiety, to talk about stress. So as we collectively understand things differently, grow, and then the general public, we as a collective, then are healthier as our collective health literacy improves.
Absolutely. Those are really good examples. I think today we couldn't even imagine, smoking indoors or not wearing our seatbelts. So it's a good reminder of how far we've come. And as we're talking about health disparities, can you speak on how, and you touched on this a little bit, so racial and ethnic minorities, how would health literacy, or at least a low health literacy, affect them?
Yeah, I mean, I think it would affect, the minority population similarly, but I think it is on us as clinicians to think about those things. Like some of I have some Liberian patients who eat fufu, and I've since had fufu since learning about it, but that would be a foreign thing to someone who grew up where I grew up, potentially.
Right.
And then there's certain foods and certain, like I mentioned, certain phrases I might use, certain foods people may eat that I don't really have a cultural understanding of, but they are
Mhm.
cultural staples for certain people.
Mhm. Right.
Whether it's sticky rice in the Hmong community, and so really, um, as people being willing and open to share a bit of our experience, because
Mhm.
I ask people all the time, what is that? Like, what food item are you describing? Um,
Mhm.
and and then actually asking them to break down the ingredients for me,
Mhm.
um, because food is a common bond amongst us as
Mhm.
humans. So no matter where you're from, um, if they are describing a food that their mom or their grandma or that they make for their family, if they're describing that food for you or to you, it's going to have a connection to them very intimately, and it gives a connection, and so. But I think that getting that insight, because there may be an ingredient in that the making of that food that is kind of causing them or leading to some of the issues they might be experiencing. Um,
Mhm.
and I think then the lack of health literacy then falls on the health professional at that point, because we need to be able to understand what the health circumstance is for the person that we are talking to. Um, and then I think sometimes in some of our communities, having the language to be able to describe in a way to another person who may not be from their cultural experience what's
Mhm.
going on with them. Um, because the word that we use for something, like some cultures don't have left and right, or don't
Mhm.
have gendered expressions, so don't have male and female
Right.
or he and she. So then how does that person then say my left foot hurts when left isn't a thing culturally for them?
Right.
Um, and so we figure out different ways to convey information. So um, yeah, so I think being open um, to questions about what's being said, um, about what people that you're saying to a health professional, but then also as health professionals being open to say, I don't really understand. Would you mind giving me a little more information about whatever that may be?
Okay. Great. Thank you.